We know that the periodontal disease usually originates and sits in hard-to-reach areas such as in between teeth. And this is where it counts for a modern oral care device to be effective and allow patients an efficacious oral care regimen. So, for example, we have conducted a study in a population of patients that has historically suffered from periodontal disease, a condition that is hard to treat and that reoccurs in these patients, and therefore they obviously face a particular challenge in their daily oral hygiene. Only recently, we completed a clinical trial with the University of North Carolina that addressed the situation of patients that have suffered from periodontal disease of various severities over many years. In these patients, we created a gingivitis situation, a situation where gums will be inflamed and show a certain level of bleeding. And after the conclusion of that initiation phase, patients started using Sonicare power toothbrushes, and the control group was using a manual brush. And it was very evident that the Sonicare group was a lot more successful in reversing this condition and healing the gingivitis situation. Similarly, we see conditions that are difficult to handle for patients when, for example, orthodontic treatment is implemented. It's easy to imagine that wiring, brackets, and appliances in the mouth make it particularly difficult to successfully brush teeth and keep a high level of oral hygiene. In an independent study that was conducted by the University of Zurich, it was clearly demonstrated, compared to many other competitor products, that the FlexCare toothbrush, and particularly the design of the brush head, contributes to a very successful and efficacious cleaning around those wires and brackets. And that is important, particularly when we think about the fact that this is a treatment we find a lot in younger adults, in children, and therefore we have to make sure that we do not create additional damage while we are correcting the position of teeth.